What are the beta lactams? Cephalosporin, carbapenem, monobactam. So, penicillin, cephalosporin, carbapenems and monobactam. Remember PCM. PCM is short form of paracetamol. P for penicillin, C to C, cephalosporin and carbapenems and monobactam. So, there are two rings. For beta lactam penicillin, there are two rings. One is thiazolidine rings and another one is beta lactam ring. This beta lactam ring is common for all beta lactam, but this other side chain as well as the thiazolidine group are different for different beta lactam, but beta lactam ring is present in penicillin, cephalosporin, carbapenem and monobactam. So, this carbon and nitrogen bond is broken by beta lactamase enzyme. They break that carbon nitrogen bond of beta lactam ring that go and that nitrogen and carbon ring of this beta lactam side chain, they are broken by the amidase. There is amidase enzyme that can break that NC bond, whereas NC bond of beta lactam ring is break down by beta lactamase. Both are carbon nitrogen bond, but they have different effect. If the amide break that carbon nitrogen side chain bond, the active material of penicillin and other beta lactam is developed, whereas by breakdown of beta lactamase ring, the antibiotic effect is lost. So, there are two rings. One is beta lactam ring, which is common for all four group of beta lactam, and there are side chains, and another ring, that is thiazolidine ring for this is specific for penicillin. Two enzyme can break two carbon nitrogen bond. If carbon nitrogen bond of beta lactam ring breaks down by beta lactamase enzyme, this antibiotic or antimicrobial activity of penicillin or other beta lactam is lost. So, it is clinically important because beta lactamase by breakdown of carbon nitrogen bond can develop করতে পারে resistance, acquired resistance against this, whereas carbon nitrogen bond in side chain, which is breakdown by amidase, helps for the release of active moiety. Clear? Both are carbon nitrogen bond. One is breakdown by sodium amidase, helpful, whereas the carbon nitrogen bond in the beta lactam ring breakdown result into the inactivity of antimicrobial activity of any beta lactam antibiotic. Not only penicillin, but other beta lactam also develop resistance if this beta lactamase break this carbon nitrogen bond in beta lactam ring. Clear এই পর্যন্ত? So, amidase, they develop 6 amino penicillinic acid which is active moiety. 6 এত মনে রাখার দরকার নেই, শুধু মনে রাখতে হবে 2 rings. One is beta lactam rings. Beta lactam CN is breakdown by penicillinase that is harmful, develop resistance against any of, not only penicillin but any of the beta lactam, whereas amide break down that NC bond which is side chain, they develop 6 amino penicillinic acid, 6 amino penicillinic acid which is active form, whereas penicillinase is one type of beta lactamase. Penicillinase is a one type of beta lactamase. Beta lactamase, they develop penicillinic acid. This penicillinic acid is not helpful or active moiety, but it causes allergic reaction, immune reaction. So side effect develop more by this penicillinic acid. And response is, so there are two harm. One is hypersensitivity activity is increased. Another one is decrease antibacterial activity or development of resistance. এই পর্যন্ত ঠিক আছে? বিটা ল্যাকটাম রিং এ NH ভাঙলে কে ভাঙতে পারে? বিটা ল্যাকটামেজ। For specific for the penicillinase, and they develop penicillinic acid which is causes hypersensitivity reaction, and they develop, by breaking this, there is development of resistance. Whereas amidase, they break that NC bond in side chain, and they develop 6-aminopenicillinic acid. 6-aminopenicillinic acid, they have, as the beta lactam ring is there intact, they have that antibacterial activity present. So first antibiotic to be clinically used in 1941, less toxic antibiotic, even now today's world, obtained from neonatum previously, now Chrysodam developed laterally. Fleming, Chain, Flore, they developed, three different scientists developed this. Original penicillin is penicillin G or benzyl penicillin. Penicillin G or benzyl penicillin. Already discussed two ring, beta lactam ring and A ring, that thiazolidine rings. Now another thing, that side chain is present or attached with the beta lactam ring, side chain, whereas COOH group is bind with the A cycle. Clear? Penicillinic acid develop resistance and allergic reaction by breaking down this beta lactam ring. How this present? Most of these penicillin G or benzyl penicillin come as a oral form or injectable form. Penicillin injectable form. Primarily penicillin comes as a injectable form, and how the sodium and potassium salt, as a sodium and potassium salt, injectable one. Injectable sodium or potassium salt is the common availability. Unit. Another important thing is unit. 1 unit of sodium benzyl penicillin is equivalent to 0.6 microgram. If we convert 1 mega unit, that is 0.6 gram. So 1 grams contains 1.6 million unit. Clear? Last eta mone rakha sobje soja. 1 gram equivalent to 1.6 million unit, not unit, million unit, MU, million unit. 1 gram equivalent to 1.6 million unit. Now mechanism proper. In the mechanism, in which type of bacteria they primarily affect? Gram positive. Gram positive, name some gram positive bacteria. Staph, Streptococcus, anything else? হ্যাঁ, শুনতে পাচ্ছি না, বলো। Corynebacterium আর হ্যাঁ, মাইক্রোব্যাকটেরিয়াম। অ্যাসিড ফাস্ট ব্যাসিলারি এর কথা বলছি, মাইক্রোব্যাকটেরিয়াম। তাহলে কক্কাইদের মধ্যে স্ট্যাপ, স্ট্রেপ্টো, নিউমো। আর গ্রাম পজিটিভ ব্যাসিলাই এর কিছু নাম জানো? হ্যাঁ, গ্রাম পজিটিভ ব্যাসিলাই কি আছে? করাইনি ব্যাকটেরিয়াম কি? ব্যাসিলাস সিরিয়াস, কোথায় ইউজ হয়? ব্যাসিলাস সিরিয়াস কোথায় কিসে কমন, কি কজ করে? ফুড পয়জনিং। এগুলো কি গ্রাম পজিটিভ ব্যাসিলাই। সো main mechanism of action based on that bacteria doesn't have any osmotic regulatory mechanism for itself. Their osmotic regulation depends upon the cell wall, not cell membrane, cell wall. They depend upon the cell wall. The bacteria itself doesn't have any osmotic regulatory mechanism. Cell wall is the one and most important mechanism for their controlling of their osmolality. Now cell wall composed of peptidoglycan, cross-link of peptides, namely N-acetyl-muramic acid and N-acetyl glucosamine, and they bind by cross-linking by pentaglycine cross bridge. এই পর্যন্ত ঠিক আছে? N-acetyl-muramic acid, N-acetyl-glucosamine, they bind cross-linking by L-lysine and D-alanine residue of the peptide glycan. So the main mechanism of any beta lactam, specifically penicillin, start with that the osmotic regulation of bacteria primarily and only controlled by cell wall, not cell membrane. They doesn't have any other osmotic regulatory mechanism. Now cell wall is composed of peptidoglycans, cross-link peptide, NAM, NAG, and they also cross-linked by L-lysine, binding with L-lysine and D-alanine residue. Cross-binding is done by another enzyme called transpeptidase enzyme, and this transpeptidase and helped by the another protein, that is penicillin binding protein, are used to making this cross linkage. Transpeptidase is the enzyme and PBP is a binding protein of methicillin. Methicillin is a one type of extended spectrum penicillin. They bind with this penicillin binding protein. These two helpful for this cross linkage, transpeptidase and PBP. So why it is important, this cross linkage? They provide the stability and strength of cell wall, not cell membrane, cell wall. So how beta lactam inhibit this transpeptidase enzyme, and transpeptidase help for cross linking. So cross linking will be damage. So damage of cross linking, and that lead to weakening of cell wall, that lead to swelling of the cell by endoosmosis. Cell wall টা টাইট থাকতো, লুজ হয়ে গেছে, বাইরে থেকে অসমোটিক প্রেসার বেশি থাকলে ফ্লুইড ভেতরে যাবে, then bacterial membrane is burst, and that lead to bacterial lysis. So this is the 5 stage by which the bacteria, it is stasis or like it is bactericidal, it is cidal. Now here the bacteria lysis, that means they kill the bacteria. So penicillin is a bactericidal. Additional mechanism is they also activate autolysis enzymes, and all these are more important or more lethal when there is a multiplication of the bacteria. Why? At that situation, this cell wall is not purely constructed. In that time, in dividing phases or multiplication of the, if there is a multiplication of the bacteria, this is more lethal. So why it is cidal? Clear? Why beta lactam antibiotics are bactericidal, not bacteriostatic? and why it is important, why it is more lethal during the dividing phase or multiplication phase. তো mechanism of action আবার একবার বলতে হবে তাহলে আরেকবার না বলতে পারবে? তো starting from first line, that cell wall is the only important mechanism for osmoregulation of the bacteria. Clear? Now cell wall composed of peptidoglycan, cross-linkage peptide, NAM, NAG, and they cross-linked. Cross-linked by what? কে cross-linkটা করে? Transpeptidase enzyme helpful for that, along with PBP, penicillin binding protein. And this cross-link provides stability as well as strength. Now beta-lactam or penicillin inhibit কাকে inhibit করে? Transpeptidase enzyme. As they inhibit transpeptidase enzyme, first what happen? Cell wall will be lax due to the less cross-linking. Then there is a swelling of the bacteria due to endoosmosis. Then there is a bursting of this membrane and then lysis. This is the proper mechanism. Along with that, they also activate autolysis enzyme. They are more lethal when there is a proliferation or multiplication of this bacteria. This is the type. There is this cross linkage. This is the cross link. Okay. So this cross link is inhibited by the beta lactam antibiotic by inhibiting transpeptidase enzyme. তাহলে কি কি ভুললে চলবে না? এক নম্বর হচ্ছে in which or portion they act on cell wall, not cell membrane. এটাই কিন্তু সবচেয়ে এমসিকিউ তে ভুল হবে, সেল ওয়াল। নাম্বার 2, সেল ওয়ালে কিভাবে কাজ করে? প্রাইমারিলি দে ইনহিবিট ট্রান্সপেপটাইডেজ এনজাইম। ট্রান্সপেপটাইডেজ এনজাইম, why it is important? They help cross linking of the amino acids. And why this cross linking is important? Because they give the strength. So if there is this cell wall is loose and lax, there will be osmosis, endoosmosis. তার মানে কি হবে? This bacteria will swell up and they burst the membrane. After that, there will be autolysis. When it is most lethal, if there is a multiplication. And additionally, they also activate autolysis enzyme. Clear? এটা কিন্তু অনেক কটা স্টেপ আছে এবং প্রাইসের জন্য লাস্টলি they act on primarily gram positive bacteria in multiplication phase, and it is static or bactericidal. তাহলে এই সব কটা কথা কিন্তু ওখানে লিখে আসতে হবে। they act on the cell wall, bactericidal, primarily gram positive, transpeptidase inhibition. By transpeptidase inhibition, the cross-linking will be not there. As there will be no cross-linking, there will be endoosmosis. As there is a endoosmosis, they will burst due to the membrane will be ruptured and there will be autolysis. So they act as a bactericidal. So now why gram positive? Why less in gram negative? Why gram positive? Why not gram negative? Gram positive, the peptidoglycan layer are very thick and they are well exposed. Whereas in gram negative, they present in between two layers and they are thin layer. Clear? For gram positive peptidoglycan, they primarily act on peptidoglycan. Peptidoglycan are much more in gram positive. Number 1. Number 2, they are well exposed. Whereas in case of gram negative, the peptidoglycan is lesser amount, and that is also sandwiched between two layers of cytoplasmic membrane and outer membrane of thin layer of peptidoglycan. So they are not easily reachable. This antibiotic cannot go there very easy. They require some barrier to cross. Clear? And another thing, gram-negative bacteria also have some porine. There are channels to penetrate that. Clear? So one explain why beta-lactam or not beta-lactam, why it is come as a why penicillin is more effective against gram-positive bacteria than gram-negative bacteria. Peptidoglycan much দুটো পয়েন্ট পেপটাইডোগ্লাইকানে একটা থিক, দু নম্বর হচ্ছে ওয়েল এক্সপোজড। for gram negative is lesser in amount and it is sandwiched between two layers, not easily accessible. So penicillins are more effective against gram positive bacteria. This is the explanation. Now some hydrophilic nature beta-lactam like penicillin, amoxicillin, they can diffuse through the porine channel, and so they have some activity against the gram-negative bacteria. Explain why penicillin is not effective against gram-negative, but extended spectrum or aminopenicillin or amoxicillin, ampicillin, that they give any of these things. Ampicillin, amoxicillin, এটার গ্রুপটার নাম হচ্ছে aminopenicillin or extended spectrum penicillin. Why they are effective against gram-negative bacteria but not penicillin? Because these are hydrophilic type of drug, they can cross the or reach the peptidoglycans of gram-negative bacteria through a porine. Whereas Pseudomonas lacks porins. Pseudomonas is a gram-positive or gram-negative? Gram-negative bacilli. Gram-negative bacilli, they lack porine. So even then, this ampicillin or amoxicillin, as porine is not there, they cannot penetrate. Clear? The ampicillin, amoxicillin, if there is porine, they can penetrate. If there is no porine, like Pseudomonas, they are ineffective. They are helpful or has a synergistic effect along with aminoglycoside. The aminoglycoside mechanism of action, how they act? আগের দিন পড়ানো হয়েছে। Protein synthesis. What are the other protein synthesis inhibitors? Tetracycline, chloramphenicol, clindamycin, or macrolide, azithromycin. This is the macrolide group of drug. These are cell. These are protein synthesis inhibitors. So aminoglycoside is a protein synthesis inhibitor. They can act synergistically because they can open up these porins also. So they are helpful for this action. So resistance, there are normal resistance against gram-negative bacteria, primary bacilli. Acquired resistance due to penicillinase, which is a beta-lactamase group, against which of these organism? Number 1, Staphylococcus, number 2, Bacillus subtilis, Gonococcus, E. coli, Enterococci, and H. influenza. So this is the primary mechanism of action of resistance, that is destruction of the drug. কিভাবে destroy করছে? By breaking down the beta-lactam ring. Beta-lactam ring এর কোনটা? Carbon nitrate bond will be killed. By this penicillinase penicillinase, which is one type of beta-lactamase, they develop resistance against Staphylococcus, Bacillus, Gonococcus, E. coli, Enterococcus, and Haemophilus. Now, other type of resistance, loss of or alteration of the porin channel of gram-negative bacteria, modification of penicillin binding protein, low affinity, activation of efflux mechanism, but these are less common with the penicillin, more common with the other extended spectrum beta-lactams. Clear? Acquired resistance is important clinically. Most important for penicillinase or beta-lactamase. Other mechanism is alteration of binding protein, alteration of protein channel for gram-negative for other beta-lactam, and efflux mechanism. Now, adverse effect. The most important and most common adverse effect is hypersensitive reaction. It is more with the MCQ, procaine penicillin, more with the procaine penicillin. For this, we do a intradermal skin test. Remember which type of skin test? Not subcutaneous. It is intradermal. Intradermal. Can you tell me one of the other drug which can be given intradermally? Most of you, if not all of you, taken that drug. Yes, BCG is the intradermal one. Intradermal is BCG. Skin test, penicillin skin test is also intradermal. Clear? Major determinant is penicillinol moiety is the determinant of this allergic activity. Minor determinant is penicillamine and penicillinate. You have to remember penicillinol moiety is the important for allergic reactions. This is the intradermal skin test, and there will be erythema. There will be erythema as well as swelling in that spot of injection. Remember intradermal skin test, not subcutaneous. Other intradermal use is BCG vaccine. This is the first is most common and most important is allergic reaction. To prevent allergic reaction, we do a intradermal skin test. If there is no allergic reaction, only then we go for intravenous or intramuscular penicillin. Next one, most common, other common infection is superinfection. What is superinfection? There will be commensal bacteria will be inhibited and pathogenic bacteria taken their place. When it is commonly happen? When there is broad spectrum antibiotic like tetracycline. Similarly, extended spectrum beta-lactam like amoxicillin, ampicillin can cause superinfection. Superinfection ki hoy primarily diarrhea. Nephrotoxicity can caused by methicillin, and which type of nephrotoxicity? It is interstitial nephritis. Interstitial nephritis caused by methicillin. Methicillin দুটো জিনিসের জন্য important. Nowadays very rarely used. One is for MCQ purpose, this interstitial nephritis or nephrotoxicity, and another one is methicillin resistance staph aureus. Which drug to be used there? Vancomycin or linezolid. Clear? And their mechanism is primarily how the penicillin binding protein they alters that, modulates that. Penicillin resistance primarily developed by penicillinase or beta-lactamase, but methicillin resistance primarily occur due to alteration of PBP, penicillin binding protein. There is less affinity of methicillin to bind with the penicillin binding protein. Clear? Then increase prothrombin time primarily due to the proxacillin. One specific entity, Jerix hexemia reaction, occur in the secondary syphilis, not for the primary syphilis, secondary syphilis. And mechanism of action, by destruction of this syphilis organism, they release the proteins and endotoxin, and they causes the allergic reactions. So there are two different. Direct penicillin can cause allergic reaction, and if a secondary syphilis patient treated with penicillin, so there is a lytic products that can cause severe type of allergic reaction resulting into fever, malaise, exacerbation of the lesions. Lesions means there is a lesions due to the spirochete. This lesion will be exaggerated. Usually occurred within 2 hours of the first dose. Treatment is steroids and NSAID. Steroids and NSAID, not only the spirochetes but also borreliasis, leptospirosis and brucellosis can cause this type of Jerix hexemia reaction. These two are the two name of two scientists, Jerix from the Austria and hexemia from the German scientist. They first described this. This is not allergic reaction primarily due to the penicillin, but the penicillin kills the spirochete. They release the endotoxin and protein products. These products are allergic because they are foreign to the host body, and they lead to severe type of fever, malaise, exacerbation of the lesion occur primarily within 2 hours of IV injections treated by steroids and NSAID. This type of reaction happen. Drug interaction, if it is given with tetracycline, chloramphenicol or erythromycin, it is antagonistic. Why? Primarily all these three are bactericidal or bacteriostatic. Tetracycline, chloramphenicol, they are static. If they are static, then means multiplication will be less. And penicillin primarily act or more lethal in if there is a multiplication is there. If there is static, they are antagonizing the action of penicillin. Similarly, aminoglycoside, they are synergism. Why? They helps to open up these porins. Similarly, if penicillin and aminoglycoside given separately, it is helpful. But if we give or draw these two medicine in a single syringe, they are antagonizing in nature. Similarly, penicillin and hydrocortisone, if they draw in a single syringe, similar syringe, they inactivate each other. Clear? This is also one type of antagonism. One is pharmacokinetic antagonism, one is pharmacodynamic antagonism, it is pharmacoceutical antagonism. Not pharmacokinetic but pharmacodynamic. Clear? If we draw this penicillin along with aminoglycoside or steroid, they will destroy each other. Similarly, if ampicillin given along with allopurinol, the maculopapular rashes will be much more. High incidence. Penicillin with probenecid, probenecid kothay use hoy? Goute. Probenecid, they prolong the action of the penicillin by inhibiting tubular secretion. Clear? So, if penicillin along with probenecid, they prolong the action of the penicillin. Ampicillin along with allopurinol, there will be rashes, more incidence. Where it is commonly used, use of penicillin for MCQ purpose, for part of the long question and for viva. You have to remember all this. First one is rheumatic fever. Rheumatic fever kothay kader hoy? Age group? 10 years, okay. Now, which organ commonly involved? Primarily involved? Which organ? Heart. And they develop pancarditis. Pancarditis means pericarditis, myocarditis, endocarditis. So, in that situation, we use we can use penicillin to prevent that infection. How it occurs? কিভাবে হয়? Streptococcus, they inhibit streptococcus, so they inhibit rheumatic fever. Similarly, SABE, subacute bacterial endocarditis. Subacute bacterial endocarditis, that is caused by Streptococcus viridans. Penicillin is used there also. Now, important thing, they use in case of active disease and importantly for prophylaxis. So, penicillin used for prophylaxis for 3 reasons. One is rheumatic fever, number 2 is SABE, and number 3 is agranulocytosis. Agranulocytosis along with other antimicrobial. But these are the prophylactic use of penicillin. Rheumatic fever, due to heart condition, rheumatic fever, subacute bacterial endocarditis, and another one is one blood condition, agranulocytosis. Other than gonorrhea, rarely used nowadays, cephalosporin is preferred as resistance develop commonly. Syphilis, in syphilis, 1.2 million unit of procaine penicillin for 12 days or 2.4 million unit of benzathine penicillin. Which one is more allergic? Which one is more allergic? Procaine or benzathine? Procaine is more allergic, reaction will be there. Leptospirosis, Wills disease, present primarily with jaundice and fever. Listeriasis Lyme's disease, 3 L tale. Listeriasis Lyme's disease and leptospirosis, all 3 diseases, here penicillin can be used. Similarly, anthrax and actinomyces, diphtheria, tetanus and gas gangrene. These are the use of penicillin. তাহলে prophylaxis কিসে কিসে? Rheumatic fever, SABE, subacute bacterial endocarditis and agranulocytosis. The use বললে এই তিনটা use লেখা যাবে prophylaxis, then gonorrhea, syphilis, 2 STD, sexually transmitted disease, then 3L, leptospirosis, Lyme's disease, listeriosis, 3L, then gram positive bacilli যেগুলো করে, gram positive bacilli, anthrax, diphtheria, tetanus and gas gangrene, Clostridium, Welsii or nowadays perfringens. এগুলো gram positive bacilli করে। তাহলে এগুলোর মধ্যে গ্রাম নেগেটিভ কোনটা করে? একটাই গ্রাম নেগেটিভ আছে। গনোরিয়া কি? গনোরিয়া, গনোকক্কাস, গ্রাম পজিটিভ or গ্রাম নেগেটিভ? গ্রাম নেগেটিভ। So most of these are gram positive infection except gonorrhea. Nowadays also gonorrhea develops, Neisseria gonorrhoeae develop resistance against the penicillin. So preferred antibiotic is preferred cephalosporin. Where it is used, mechanism of action, use of it in drug interaction, ড্রাগ ইন্টারাকশন, দেন সাইড এফেক্ট মনে রাখতে হবে, অ্যালার্জিক রিয়াকশন, জোরিক সেক্সিমিয়া রিয়াকশন, দুটো হয়ে গেল। আর স্পেসিফিক্যালি আর কি করে, দু তিনটে মনে রাখতে হবে ফর এমসিকিউ পারপাস। মেথিসিলিন কি করে? মেথিসিলিন প্রথম বিনটা ক্লক্সাসিলিন করে, বোধহয় লেখা ছিল না। মেথিসিলিন কি করে? ইন্টেস্টিসিয়াল নেফ্রাইটিস। সুপার ইনফেকশন কে করে? অ্যাম্পিসিলিন, এক্সটেন্ডেড স্পেকট্রাম অ্যাম্পিসিলিন। সাইড এফেক্টস ক্লিয়ার। আর মেকানিজম অফ অ্যাকশন, ইউজ, সাইড এফেক্ট, ড্রাগ ইন্টারাকশন। হবে তো এগুলো মেকানিজম অফ অ্যাকশন? একটুখানি কিন্তু খটোমটো আছে, সব কটা পয়েন্ট কভার করতে হবে। শুধু যদি ইট, ইনহিবিট, ট্রান্সপেপটাইডেস লেখো তাহলে কিন্তু ওই 3-এ 1 ফ্যাক্ট পেয়ে যাবে। ট্রান্সপেপটাইডেস কি করে? ক্রস লিঙ্ক করে। কোথায় ক্রস লিঙ্ক করে? সেল কোথায়? ওয়ালে। Why it is important? It prevents the endoosmosis. In absence of this, there will be endoosmosis, there will be swelling of the bacteria, there will be bursting, and there will be autolysis. It is gram active on gram positive bacteria, multiplying bacteria, and it is bactericidal.